So there are a number of things that are different now compared to a few years ago. In 2013, public health came home to local government, so we now commission a wide range of public health services, and councils across the country are taking advantage of that in joining up public health across the life course with all of the other services that can affect the wider determinants of health. So we know that employment is a factor which determines your health and well-being. Having a good job makes a big difference. We also know that people who suffer from poor health are likely to have poor employment outcomes. So there's a massive synergy between having a health strategy which thinks about employment and an employment and skills strategy which thinks about the wider health implications. The LGA works with Public Health England to think about the kind of evidence which is most useful for local commissioners when they're thinking about the kind of support that's needed for individuals and communities so that they can have healthy and fulfilling lives. We have further to go, I think, to make that evidence really accessible and easy to be used by commissioners. And we need to have a conversation about what kind of evidence is most useful for people on the front line and people thinking about services in the round. Well, the World Health Organization has done a lot of analysis of that internationally. You can find some commentary on it in our manual on health in all policies, which is on the LGA website. Some of the barriers are about needing to think differently. So you need to put a different hat on when you're thinking about health in all policies. But if you can have the enthusiasm and leadership and understanding of the shared agenda that you want to pursue locally through health in all policies, you can get a very long way. There's no one answer to that question. They need to think about what their local priorities are, what assets and opportunities they have locally, and to think about what their priorities should be collectively in their local area, and that will give them the answer. Well, it was great to talk between Sir Michael Marmot and Martin Reeves. They're both fantastic speakers and inspirational. I think we also have an audience which is really well placed to have a good and constructive discussion today because it's multidisciplinary, it comes from all walks of life, and clearly people have come here with a passion for health in all policies, wanting to learn and contribute.